I did make contact with Senator Ron Johnson's office. They called me, but I'm hoping to get my story to him personally.
Thousands, tens, hundreds of thousands of people are permanently disabled or possibly lost their life because our FDA hid the fact that there were safety signals screaming at them with the COVID injection.
I want him to see my scars, see what I've been through, hear my story, and share it with so many others who unknowingly may have urticarial vasculitis and not know it. My name is Nurse Lisa Michelle Moore. I have been a nurse for 36 years. I became a nurse when my mother took care of my grandmother. She had a stroke and I was 18 years old. And my mother moved her into our house. And I just enjoyed caring for my grandmother. There was just so much love and the care and seeing how appreciative she was with me. And so I became a nurse. I've always loved taking care of the elderly.
If you miss me from singing down here and you can't find me nowhere, you just come on up to Bright Glory and I'll be waiting up there.
I'll always be an advocate for the elderly. I just had that love for them, and it was joy in my heart to see about them and take care of them. Not just them, but all the patients I've taken care of. I've taken care of about 60,000 patients in my lifetime. And every experience, some of them haven't all been good, but most of them have been so wonderful. Just seeing the joy I can bring to other people's lives really meant a lot to me. And I feel like it's been taken away since I got the jab. December 2021, 5 days after I got the booster, I started having sores on my left leg. They were very painful. I really didn't connect it to the jab at that time. We thought it was spider bite, cellulitis, but the spider kept biting. I started having painful sores. I kept going into the hospital back and forth. They put me on medication once they determined through a biopsy that I had this rare autoimmune called urticarial vasculitis, which attacks the red blood cells and they attack my body. So they start putting me on medicines, experimental drugs. Dapsone was one of them. They give it for patients with leprosy. I was in heart failure, congestive heart failure, and I was in respiratory failure. I had an oxygen sat of 59. I had a blood clot in my lung. I start thinking, about the vaccines and the effects of it. And then I start reading more the more I read. And then I realized, I said, oh my goodness, it started 5 days after I got the vaccine. So I contribute to that because I was fine until then. I know we had warp speed here, and I guess it was everywhere. I wasn't a very strong advocate for taking the COVID-19 vaccine, but the pressure of society, I ended up taking it myself. I thought I was doing it to help the others that I would be around. And it was the biggest mistake of my life. I made a mistake and I can't take it back. I can only ask God to help me get through this trial. I'm like Job, though he slay me, I will trust him. I have to. That's all I have, my faith, and that's enough. Just getting up in the morning and putting on clothes and taking a shower, sometimes it hurts because of the lesions. It's changed my life as far as going out into the community, helping others like I was. So it's been depressing. I'm not the same. How can I be the same? I'll never be the same again. And I'm just relying on the goodness and kindness of others right now. I've helped so many patients and families, and I need help myself now. This is a series of when the nurse becomes a patient. I've been through so much as far as the pain, not just from the illness. It's been a lot of pain in my heart too. When you reach out to people and they don't help you, and they can, even my facility where I'm disabled from. My sponsors reached out to them and no responses from them. It's really embarrassing. It's very disheartening to me as well. The first treatments that were happening when they found out I had urticarial vasculitis, they put me on steroids, prednisone. I was on a very high dosage, 60 milligrams a day.
And what is that supposed to do?
It's supposed to suppress my immune system. They use it as an immunosuppressant. They put me on that, and then they did a special testing for the dapsone, which they give patients for leprosy. Like I said, everything's experimental. So I was on colchicine. It's a gout medicine they give patients. They put me on that. Hydroquinone, Plaquenil, but the dapsone, it was a bad reaction. I felt like I was dying when I was on the dapsone. It made my red blood cells really big. I had to stop taking it. I was on oxygen for 6 months when I was on dapsone. It wasn't contributed to the dapsone at first, but then my rheumatologist called me and said he saw my labs and that my red cells were bigger and to stop taking the dapsone. And you have to understand, I was on oxygen 6 months. For 6 months, I had to wear oxygen for my breathing, wheezing. I have asthma, and they put me on all those immunosuppressant drugs, and I had bad reactions to them. So I'm not just fighting the urticaria, I'm fighting the effects of the medications. It's like the jab was free, but was it really? Was it really free? It cost me a lot.
Mm-hmm.
But
let's play this clip. I've got a clip here that I want to play.
Sure.
Let's watch this with Dr. Paul Merrick.
So that we know the spike protein is a protein. So a protein consists of a string of amino acids. It's about 1,400 amino acids in a string expressed on the surface of COVID. So it's what the SARS-CoV-2 virus uses to bind to the cell. It's called the spike protein. It just so happens that spike does all kinds of really bad things. And one of the things that it does is it confuses the immune system by something called molecular mimicry. So what happens is the host makes an antibody against spike, but that antibody cross-reacts with your own proteins, your own cell surface antigens. So there's molecular mimicry, means that the spike has certain antigenic sequences which are already common to the host. So that instead of making an antibody which deals with the spike, it actually makes an antibody which then reacts against host tissue. And so people have looked, and there are hundreds, if not thousands, of different autoantibodies which people make after being vaccinated. And the autoantibodies seem to be much more common after vaccination than with natural SARS-CoV-2 infection. It happens with SARS-CoV-2, but we have to remember that the spike protein that's expressed by the RNA of these jabs is being modified. So this is a modified spike protein. The uridine nucleotides are pseudouridine, so they're handled by the body differently. They're not broken down by the body. Some of the nucleotides are changed. So what happens is the body then makes antibodies which cross-react with itself. And this results in terrible autoimmune diseases where the body is now making antibodies against itself. And, one of the most common is Guillain-Barré syndrome, in which you're making antibodies against the myelin sheath of nerve fibers. So what happens is people get a paralytic disease. These antibodies are attacking their spinal cord and their nerve fibers. But these antibodies basically are attacking the brain, they're attacking the heart, they're attacking, you name it. There are all antibodies against multiple different cell components.
Okay, were you able to listen to all that?
Yes, I did.
And what do you think about that explanation?
I think it's a good explanation. I think it's the reason I'm sick, fighting urticarial vasculitis. My immune system has turned against me. It's fighting me, and I can't stop it.
Let's explain urticarial vasculitis to people who don't know what that is.
It's a disease where my immune system attacks my red blood cells, and they become inflamed, and I start having sores. It attacks the biggest organ, which is my skin, as you can see. Now they're trying to save my inner organs from being attacked by my immune system. So it's already started attacking me. If I'm stressed, it'll attack mode. Anything. Sometimes I don't have to do anything, and I start having itching. It starts with itching, then it starts with blisters, then the wounds open sores like a rosebud, and then nothing but nerve pain, throbbing nerve pain. And like I said, I'm on a lot of medication, and that's affecting my body as well. The steroids are affecting my mouth. My teeth are coming out. It's affecting my hip. I have osteoarthritis. I'm bone on bone with my hip. It's attacking my joints, this disease. And I have to get labs drawn a lot. It really frustrates me sometimes, though, when the rheumatologist will send me, he's an hour and a half away from me. I've seen him pictures and upload stuff with pictures. And then I take it to the hospital. He tells me what he wants them to order, and they disregard it. They disregard them. And I'm fighting a rare disease that no one knows about.
So has any of the doctors that you've seen spoken to you about spike protein?
None of them have spoken to me about spike protein out of 30-something different doctors that have been on my case. I'm talking about from radiology, pain management, to my primary doctors, even all the hospital admissions. No one ever mentioned a spike protein. Vaccine adverse event reporting system is what they call it for VAERS. What I did was I went online. I did a login, and I reported that I have urticarial vasculitis and the dates I got it, the dates I was confirmed. And I have not heard from them, as far as the CDC reaching me or anything. I haven't heard from them yet. They're supposed to investigate it. I was told that they have my chart with the CDC, but no one's contacted me. It's just a program that they use to monitor the safety of vaccines. But there's been a lot of injuries reported to VAERS. I have a doctor at Emory. His name is Dr. Tiliakos. He is a rheumatologist. And it's on my medical report. They got me allergic to the COVID-19 vaccines now. And he reported that I got urticarial vasculitis after I got the COVID-19 vaccine. Before I was just really investigating the issues and the protein, spike protein and stuff, we haven't gone that far. It's like they're just treating what's going on. They're not treating the urticarial vasculitis because there's no cure. They're treating the symptoms of my disease, which is the wounds, the pain, the nerve pain, the mental aspect of everything. It's been a lot to deal with, but no one's talking about it until now, until Senator Ron Johnson started talking about it, and he really started advocating for us. But it's real. I want him to know it's real what I'm going through. Not just me, but so many others. It's really important to me to reach Senator Ron Johnson because he is an advocate for us. I see that he's speaking out for us, not just me, not just the vaccine injured, the ones that died from the COVID-19 protocol. He's really advocating. And Senator Ron Paul, Senator Robert F. Kennedy, I'll be open to any of them three. I did make contact with Senator Ron Johnson's office. They called me. But I'm hoping to get my story to him personally. I want him to see my scars, see what I've been through, hear my story, and share it with so many others who unknowingly may have urticarial vasculitis and not know it. I've looked up images of urticaria, but I'm the only Black person that I know that has urticarial vasculitis. The skin, I can post my skin all day long, but it's so different. So I am getting another biopsy, but I want to get to Senator Ron Johnson to tell him that he's right. He is. And I appreciate him helping us, and I'm praying for him and his safety as well.
Now, if he gives you the opportunity to speak, and he has a huge platform.
Yes.
What do you want the American people to understand about what's not being reported?
I want them to understand that it's not being reported, all the injuries and deaths from the COVID-19 vaccine. I reported my stuff to VAERS, the vaccine injury line, and my chart is in CDC. I suspect it is. They said it is, but I've heard from no one, and we don't have compensation at all. By the time you realize that you may have had a COVID injury, it's too late to file for that $4,500 that they give you. They rejected me when I tried to file because I filed outside of the 1 year limitation. It's not fair to me, and it's not fair to so many others who can't bear this burden alone. It's just not right, and we need help. And we have not because we ask not, and I'm asking for help from Senator Ron Johnson to help us. help me get to Washington, help me tell my story. And hopefully it will inspire others to tell their stories.